Hello, this is Sarah on 3 South. I'm calling transfer report on a patient we're sending to you guys. Patient's name is Sierra Miss. This is a 43-year-old female, full code. She was admitted on the 26th with respiratory failure. Before having to call a rapid response on this patient, she was on 7 liters Salter Lab. Her O2 sats were at 82. Patient was in obvious signs of respiratory distress. She was having shallow respirations. She was very anxious, diaphoretic, having to use accessory muscles to breathe, and she was hyperventilating. Patient has a history of interstitial lung disease, obstructive sleep apnea, obesity, and type 2 diabetes. This morning's x-ray showed that patient has bilateral pulmonary infiltrates. We did a stat ABG on this patient. She's at a pH of 7.3. Her PaCO2 is at 71. Her bicarb is 33. Her most recent vital signs were blood pressure 147/83, pulse was 107, respiratory rate was 34, her O2 sat was 82, and her temp was 98.9. During the rapid response, we placed this patient on a BiPAP. Doctor's recommending we get her on a closer monitored unit for possible intubation. We're going to be doing a repeat ABG on this patient in 1 hour. Again, the doctor's recommending we place this patient on a telemetry monitor, have intubation materials on standby, and do a repeat ABG in 1 hour. If you can think of any further questions, feel free to give me a call. Thanks. Hello, Sarah on 3 South. I'm calling you in reference to the patient Mountain Dew. This patient is a 72-year-old male. He was admitted under sepsis. Upon assessment, this patient was having difficulty breathing, very coarse lung sounds, and +3 pitting edema in the bilateral lower extremities. This patient has a history of chronic heart failure, peripheral vascular disease, hypertension, diabetes type 2, and arthritis. While the patient was in the ED, he received the sepsis protocol. He got a 2-liter bolus of normal saline. After that, he was put on a continuous normal saline at 125 mLs an hour. Patient's recent vital signs: blood pressure was 197/102, pulse was 83, respirations 27, O2 sat was 91, temp was 99.2. Recommending some IV Lasix. The patient seems to be in fluid volume overload. Also recommending this patient have their continuous fluids discontinued.